Hello and welcome to Abnormal Psychology. This will be a review of Chapter 3 on assessment in the book Abnormal Psychology, Clinical Perspectives on Psychological Disorders, 9th edition by Susan Krauss Whitbourne and published by McGraw-Hill Education. Today we're going to be looking at psychological testing. Psychological assessments are procedures in which clinicians provide formal evaluation of a person's cognitive, personality, and psychological functioning. A broad range of measurement techniques are used, and they involve having people provide scoreable information about their psychological functioning. As a result of economic pressures and strong desire on the part of employers to hire the most qualified individuals to perform specific jobs, many psychologists are being asked to administer pre-employment psychological tests to prospective employees. Testing can provide valuable information regarding a person's motivation, honesty, intelligence, and aptitudes. In some research by Saul in 1990, they noted that it is important that this type of testing be done by a trained psychologist who has business experience and knowledge of legal requirements in order to avoid any equal employment opportunity related litigation. He also notes that testing performed should meet objectives specific to the position the person's applying for. The implication is that the information beyond those objectives is highly personal and, if used inappropriately, could spark legal action. Some of the tests used are the Myers-Briggs Type Indicator, the Guilford-Zimmerman Interest Survey, as well as other well-known inventories. But in some instances, more high-powered, clinically oriented tests are administered. For example, individuals who apply for some positions, such as corrections officers in the state of New York, are required to take the MMPI. If these individuals score too high on some of the subscales on the MMPI, such as psychopathic deviancy, they're turned away. It is important to look at psychological testing from the point of reliability, meaning that it consistently gets the same scores as it is used across time frame and different individuals. So for instance, if I administered the test to a person on one day and waited a week and give it to them again, I should get similar scores. Validity refers to the test measuring what it's supposed to measure. And this really comes into question when we look at cultural relevancy of tests. The results of early studies such as Bottomer and Cavalli-Sforza's 1970 study clearly indicated that Caucasians perform better than African Americans on IQ tests. Although some researchers attempted to attribute these IQ differences to genetic factors, the fact is that since the 1950s, intelligent testing has spawned a debate regarding the cultural and racial biases inherent in some of the more common intelligence tests. Criticism centered on the fact that some of the popular IQ tests were keyed to white, middle to upper class social groups. One particular test asked whether a cup goes with a plate, bowl, spoon, or saucer, which could be relevant to a person's culture. Another asked questions like, who wrote Paradise Lost? Similarly, Western cultures consider it to be more intelligent to group things on what they are, and some IQ tests are structured in that way. However, individuals, like from the Capel tribe in Nigeria, sort items based on what they do, not what they are. Although some researchers have attempted to develop culture-free tests, void of verbal language and timing requirements, most theories agree that constructing an IQ test entirely free of cultural bias is impossible. Some researchers go as far as arguing that the concept of intelligence is intimately wed to culture. In fact, some see intelligence as one's ability to survive in a given culture. The fact remains that psychologists who interpret the results of IQ tests should take into consideration the cultural background of the taker. To illustrate some cultural biases, I'm going to show you the Chitlin test. Here are some examples of questions on the Chitlin test. It was developed by Adrian Dove, who is a Black sociologist. It is a humorous example that demonstrates the built-in cultural bias found in most IQ tests. Aware of the dialect differences, he developed this exam as a half-serious attempt to show that American children do not all speak the same language. The URL has been provided if you would like to look at the test yourself. To ensure clinicians use the best assessment methods possible, they should adhere to the principles of evidence-based assessment, which includes relying on research findings and scientifically viable theories, using psychometrically strong measures, and empirically evaluating the assessment process. Clinical interview is a series of questions that clinicians administer in a face-to-face interaction with the client. Unstructured interviews are a series of open-ended questions. Information sought through interviews are things such as the reason treatment is being sought, symptomology, one's health status, family background, and life history. A structured interview consists of a standardized series of questions with predetermined wording and order. And a structural clinical interview for the DSM-5 disorders is provided as well by the American Psychiatric Association. Here is another example of the information usually obtained in a clinical interview: one's age and sex and basic demographic information, the reason they're coming in for treatment, their work and education history, their current social situation, like relationship statuses with their family and potential loved ones, physical and mental health history, which can give you a lot of information in terms of past behaviors and which can help predict future behaviors, drug use and medication use, and that can be prescription and non-prescription, family history, to see if there are psychological disorders that run in the family, and behavioral observations, which can be nonverbal behaviors, whether someone is exhibiting anxiety or an altered mood, if they're experiencing difficulties in maintaining their attention. They will also try to determine their mental status and compare their appearance with those of like age and culture. Part of this assessment process also includes whether someone is oriented to time, place, and person, and whether they are exhibiting any unusual motor behaviors. The mini mental status examination is a method of objectively assessing a client's behavior and functioning in a number of spheres, with particular attention to the symptoms associated with psychological disturbances. Areas assessed in the mental status exam are appearance, attitudes, behavior, mood and affect, speech, thought processes, content of thought, perception, cognition, insight, and judgment. The mini mental status examination is a structured tool used by clinicians as a brief screening device to assess neurocognitive disorders. They administer a set of short memory tasks and compare the client's scores to establish norms. If the client scores below a certain cutoff, the clinician then continues to more thorough testing to determine the nature and extent of potential cognitive impairment. Here is an example of the mini mental status examination. You can see the orientation to date and time with what is the year, where are we now. The examiner also will give the client 3 unrelated objects clearly and slowly and ask them to name them. Then they will have the client count backwards from 100 by 7s or spell the word world backwards. Then they will ask them to recall the 3 items they had them identify earlier, after which they will show the patient 2 simple objects such as a wristwatch and a pencil and ask them to identify them. Then they will ask them to repeat the phrase no ifs, ands, or buts, and then they will give them directions. They will hand them a piece of paper and give them the instructions to take the paper in their right hand, fold it in half, and put it on the floor. Then they will tell them to please read this and do what it says and hand them some written instructions that say close your eyes. Then they will give them paper and ask them to make up and write a sentence about anything. And the sentence must contain a noun and a verb. The last exercise is where the examiner shows the patient a picture of 2 pentagons that are overlapping and asks them to replicate the drawing. All 10 angles must be present and the 2 items must overlap. Here is how the scores are looked at. Based on whether the person is able to complete the task that we previously spoke about, will determine if they receive the points for those items. Patients who are unable to complete those tasks that only receive 0 to 10 points may not be testable and indicate marked impairment. They're likely to require 24-hour supervision and assistance with their adult daily living skills. As it moves up, we go from moderate, with formal assessment may be helpful and there's clear impairment, mild, Formal assessment may be helpful to better determine a pattern and extent of deficits, and there's a significant effect, and then questionably significant. If the clinical signs of cognitive impairment are present, formal assessment of cognition may be valuable, and they may have clinically significant but mild deficits. Moving on to intelligence tests. Intelligence testing include overall cognitive evaluation, diagnosis of learning disabilities, determination of giftedness, prediction of intellectual disability, prediction of future academic achievement, diagnosis of neurological and psychiatric disorders, and evaluation of potential employees. Howard Gardner suggests that intelligence should be assessed through a multifaceted approach. His theory suggests that we have different levels of intelligence in different domains, such as language, spatial, math, and musical skills. This theory is in great contrast to that of the single intelligence theory. One popular intelligence test is the Stanford-Binet Intelligence Test, 5th edition. The average deviation IQ score is set at 100 with a standard deviation of 15. Deviation intelligence is an index of intelligence derived from comparing one's score on an intelligence test with the mean score for that individual's reference group. The Stanford-Binet yields scores on measure scales such as fluid reasoning, which is the capacity to think logically and solve problems in novel situations, knowledge, which are the facts, information, and skills acquired by a person through experience or education, quantitative reasoning, which is the act of understanding mathematical facts and concepts and being able to apply them in real-world situations, visual spatial intelligence or spatial reasoning, which is the capacity to imagine or visualize in your mind positions of objects, their shapes, their spatial relations to one another, and the movement they make to form new relations. Working memory is the small amount of information that can be held in your mind and used in the execution of cognitive tasks. That is in contrast with long-term memory, which is the vast amount of information saved over your lifetime. Here are the 4 types of abilities assessed by the Stanford-Binet. Here are some examples of how they are measured. Fluid reasoning can be measured by sorting pictures into groups of 3. Knowledge, showing how to perform a given action. Quantitative reasoning, counting a set of items. Visual spatial reasoning, assembling puzzle-like forms. And working memory, recalling a sequence of taps. The Wechsler Adult Intelligence Test is another intelligence test that is quite popular. It's the first comprehensive individual test that researchers specifically designed to measure adult intelligence. It produces an overall IQ score based on an age norm mean of 100 and standard deviation of 15. It scores on verbal comprehension, which is one's ability to understand the language used by others as determined by their receptive vocabulary and language skills. Perceptual reasoning, the ability to take in visual information, organize it, interpret it, and use it to solve problems. Working memory, again, is that small amount of memory that can be held in your mind and used in the execution of cognitive tasks. And processing speed, which is the cognitive ability defined as the time it takes a person to do a mental task. It is related to the speed in which a person can understand and react to information they receive, whether it's visual, auditory, or movement. Here are the different scales of the ways. And here are some ways in which those scales measure those different skills. Verbal comprehension, there's vocabulary, information comprehension, the similarity test. And here are some examples of defining terms, asking what something means. Perceptual reasoning, looking at matrix reasoning, visual puzzles, block design, picture completion. So looking at patterns and shapes. Working memory, looking at recalling a series of digits forwards and backwards, and recalling sets of digits from smallest to largest, and with mixed numbers and letters. Processing speed is measured by symbol search coding test. So they copy numbers that match symbols into appropriate boxes. Here's a figure that shows the different scales that are used in the Wechsler and how that is used to create a combined IQ score. Personality is also assessed using testing. Clinicians use tests of personality to understand a person's thoughts, behaviors, and emotions. Self-report clinical inventories that are used are the Minnesota Multiphasic Personality Inventory, or MMPI-2, the Neo-Personality Inventory, the Personality Assessment Inventory, and projective tests that are used are the Rorschach ink blot test and the thematic apperception test. These tests differ in nature on their items and the way that they are scored. Self-report clinical inventories contain standardized questions with fixed response categories that the test taker completes independently, like a survey. The test taker completes the test and self-reports to the extent to which the responses are accurate. On the MMPI, this new version contains restructured clinical scales. When you look at projective testing with the Rorschach, the test taker is presented with an ambiguous item or task and is asked to respond by providing their own meaning or perception. The Rorschach projective assessment method is where individuals describe their perception of sets of symmetrical ink blocks. So kind of like when you do tie-dye. Put some different colors on a paper, fold it in half, and then each half is identical to the other. The Rorschach is the most famous of the projective test. The technique was named after Hermann Rorschach, who created a series of ink block designs in 1911. He published the book Psychodiagnostic in 1921. The test taker is instructed to look at each ink blot and describe what it looks like. The Rorschach test is one of several types of projective tests. Projective tests are commonly associated with approaches that focus on the unconscious determinants of behavior. Clinicians who are interested in more conscious or evoked behaviors may select different battery of tests. The thematic apperception test is where individuals invent a story to explain what is happening in a set of ambiguous pictures. Here's an example of an ink block. What do you see? There are also behavioral assessments. Unlike the psychological test, behavioral assessments record actions rather than responses to rating scales or questions. It is a form of measurement based on objective recording of an individual's behaviors. It includes descriptions of the events that precede or follow the targeted behavior. According to Clifford in 2006, there is a systematic approach to interviewing, testing, and evaluating job candidates. The system begins with what is called behavioral interviewing, in which candidates are barraged with tough questions about how they have handled specific assignment problems. While cognitive tests have a slightly closer correlation with job success, personality tests are often useful both as a basis for interview questions and for subsequent development. Think about interviews that maybe you have experienced for jobs. What kind of questions were you asked? Behavior assessments look at target behaviors, which are the behaviors that have been selected to change. In vivo observation is naturalistic observation. It happens in real life. Analog observations are where individual behavior is observed in an artificial setting that imitates a naturalistic environment. Think about the cost saved by having people come to a lab and sit in what looks like a living room, and researchers observe their behavior in response to a stimulus versus trying to find people out in the real world to observe. Behavioral self-reports are where participants reflect on their behaviors across a variety of unstructured real-life situations. And self-monitoring is where clients are asked to monitor and regulate self-presentations, emotions, and behaviors in response to social environments and situations. So you may ask a client to keep a log of when they feel anxiety, for example. Behavioral interviewing is a structured interview approach built on research that past behavior predicts future behavior. In a behavioral interview, the candidate provides concrete examples of how they use specific behaviors or skills on the job. So you may be asked in an interview to give an example of a time in which you had a conflict with a coworker and how you handled it. There are also multicultural assessments, and one's culture needs to be taken into account in all testing. You need to look at the person's cultural, ethnic, and racial background. Psychological tests are continuously reevaluated to ensure that clients from a range of diverse backgrounds can understand the items. The cultural formulation interview is a set of questions that assesses the impact of culture on key aspects of a client's clinical presentation and care. Clinical programs train graduates to understand the cultural backgrounds of clients that they assess and how that impacts their diagnoses as well as their treatment. The CFI, which is a cultural formulation interview, is a set of questions that assesses this impact of culture on the client's clinical presentation and care. It assesses their cultural identity, the individual cultural conceptualizations of distress, the way the client's culture defines vulnerability and resilience, and any cultural differences between the client and the clinician. Questions on the CFI include questions such as, What are the most important aspects of your background or identity? Why do you think this is happening to you? Background or identity, in turn, refers to the communities in which one belongs, the languages you speak, where you or your family are from, your race or ethnic background, your gender or sexual orientation, or your faith or religion. Neuropsychological assessment is a performance-based method assessing cognitive functioning used to examine cognitive consequences of brain damage, brain disease, and severe mental illness. Clinicians can choose from tests that measure attention and working or short-term memory, processing speed, verbal reasoning and comprehension, visual reasoning, verbal memory, and visual memory. Executive functioning is the ability to formulate goals, make plans, carry out those plans, and then complete them in an effective way. Adaptive testing is where the client's responses to earlier questions determine the subsequent or future questions presented to them. They build upon each other. Here's some examples of some neuropsychological assessments: trail making test, clock drawing, Wisconsin card sorting, the BNT, which is the Boston naming test, the WMS4, which is the Wechsler Memory Scale, 4th edition, and the CANTAB, which is the Cambridge Neuropsychological Test Automated Battery. Here's what a trail making test looks like. There are 25 circles distributed over a sheet of paper. The patient is supposed to draw lines to connect the numbers in descending order. In a similar worksheet, which is considered Part B, the circles include both numbers and letters. On this worksheet, the patient draws lines to connect the circles in an ascending pattern, but with the added task of alternating between the numbers and letters on Part B. The patient should be instructed to connect the circles as quickly as possible without lifting the pen or pencil from the paper. They are timed as they connect the trail. Errors affect the patient's score only in that the correction of errors is included in the completion time for the task. It is unnecessary to continue the test if the patient has not completed both parts after 5 minutes have elapsed. In scoring, the results for both Part A and B is reported as the number of seconds required to complete the task. So the higher the score reveals the greater impairment. The clock drawing test is able to detect mental decline, as people with dementia often have problems reading traditional clocks. Reading clocks requires you to interpret the placement of the hands on the clock and the time that they are meant to represent. This ability is often lost when people have early dementia. With dementia, many aspects of cognition are affected, including executive functioning, which are your mental skills involving working memory, flexible thinking, and self-control. Visual spatial ability, which is the ability to perceive the relationship of objects in space. Motor programming, the ability to represent sequence and movement in abstract form. Attention and concentration. All of these skills are involved when a person is asked to draw a clock. Any difficulties with the task suggest that a person may have dementia. Studies have shown that the clock drawing test can detect early dementia even when other tests, such as the mini-mental status, are normal. The Wisconsin card sorting test is a neuropsychological test that is frequently used to measure such higher-level cognitive processes as attention, perseverance, working memory, abstract thinking, cognitive functioning, and set shifting. It is particularly used in clinical fields to measure preservative behaviors that refer to an individual's insistence on wrong behavior and the ability to display flexibility in the face of changing schedules of reinforcement. Moreover, to be able to change category, one needs to have high intellectual flexibility and ability in concept formation. The Wisconsin card sorting test consists of 2 card packs having 4 stimulus cards and 64 response cards in each. Each card is around 7 by 7 centimeters, and there are various geometric shapes in different colors and numbers. The participants are expected to accurately sort every response card with one of 4 stimulus cards through the feedback of right and wrong, given to them based on a rule. The Boston naming test is one of the most widely used measures of naming. The original version of this test included 85 items. However, the shortened version, produced in '83, is used more frequently. The test consists of 60-line drawings of objects and graded difficulty, ranging from very common objects like a tree to less familiar objects such as an abacus. Although the original normative data are scanty, several studies have provided supplementary norms. These studies have been comprehensively reviewed recently by D'Elia in 1995. The Boston naming test was introduced in 1983 by Edith Kaplan, Harold Goodglass, and Sandra Weintraub, and it is widely used to measure confrontational word retrieval in individuals with aphasia and other language disturbances caused by stroke, Alzheimer's disease, and other dementia disorders. This is an example of the Wechsler memory scale, where individuals are shown cards and then asked to reproduce what they see. This is an example of visual memory in a patient with encephalitis before and 6 months after treatment, who was evaluated using immediate recall subtests from the WMSR template and immediate figure reproduction before shunting and 6 months after shunting. So here's what they were shown. This is what they did before they received a shunt to reduce the pressure on their brain. And this is how they reproduced the same figure after a shunt was installed and pressure was relieved on the brain. So you can see some differences in how they're able to get the orientation of these here, as well as this figure here. The Cambridge Neuropsychological Test Automated Battery includes highly sensitive, precise, and objective measures of cognitive function correlated to neural networks. The CANTAB tests have demonstrated sensitivity to detecting changes in neuropsychological performance and include tests of working memory, learning and executive function, visual, verbal, and episodic memory, attention, information processing and reaction time, social and emotional recognition, decision-making, and response control. Executive function is the cognitive domain that comprehends high-level thinking and decision-making. It can be divided into the subdomains of mental flexibility, which is the ability to transition between thinking about different concepts, planning, the ability to mentally select and appropriate action to achieve a desired goal, strategy, the ability to implement strategic thinking for problem solving, and response inhibition, the ability to suppress inappropriate responses. I have included a video on digital span. Digital span is a measure of verbal short-term and working memory that can be used in two formats. There's forward digital span and reverse digital span. While superficially very similar tasks, forward and backward span rely on somewhat separable cognitive capacities. The simpler forward span task requires verbal working memory and attention, while the backward span task additionally tests cognitive control and executive function.
The next task we will try is called Digit Span. It is a memory test that involves remembering numbers. I will say a sequence of numbers. Please try to remember them. Let's begin. 8, 1, 6. Okay, after the beep, please repeat the sequence of numbers.
8, 1, 6.
3, 1, 7, 9.
3, 1, 7, 9.
Now I will say a sequence of numbers again. This time, please say the sequence of numbers backwards. Let's begin. 8, 5, 2. Okay, after the beep, please repeat the sequence of numbers backwards.
2, 5, 8.
9, 3, 6, 7.
7, 6, 3, 9.
Neuroimaging provides a picture of the brain structures or level activity. So here are some types of neuroimaging methods. The electroencephalogram, or EEG. An EEG is a test that detects abnormalities in your brain waves, or in the electrical activity of your brain. During the procedure, electrodes consisting of small metal discs with thin wires are placed into your scalp. The electrodes detect tiny electrical charges that result from the activity of your brain cells. A CAT scan allows doctors to see inside your body. It uses a combination of X-rays and a computer to create pictures of your organs, bones, and other tissues. It shows more detail than a regular X-ray. An MRI is a medical imaging technique that uses a magnetic field and computer-generated radio waves to create detailed images of the organs and tissues in your body. Most MRI machines are large tube-shaped magnets. A PET scan is an imaging test that can help reveal the metabolic or biochemical function of your tissues and organs. The PET scan uses a radioactive drug or tracer to show both normal and abnormal metabolic activity. A SPECT scan lets your doctor analyze the function of some of your internal organs. A SPECT scan is a type of nuclear imaging test, which means it uses a radioactive substance and a special camera to create 3D pictures. The MRS is an emerging technology that allows for the quantitative non-invasive assessment of regional brain biochemistry. It's used to study metabolic changes in brain tumors, strokes, seizure disorders, Alzheimer's disease, depression, and other diseases affecting the brain. When molecules are placed in a strong magnetic field, the nuclei of some of the atoms will begin to behave like small magnets. The resonant frequencies of the nuclei are then measured and converted into an NMR spectrum that displays all of the right frequencies as peaks on a graph. Here are some images from a CT scan here, an MRI with contrast, a PET scan, and a SPECT scan. Here they're comparing Alzheimer's disease, and this is what depression looks like in the brain from a SPECT scan. I hope this has been helpful. Thank you, and have a great day.